Good afternoon, everyone, and welcome to our regular series of Posturite Lunchtime webinars on what is, at the moment, a very nice spring day. Well, it is where I am, I suppose, at least anyway. My name's John Ridd, and I'm taking the anchor role for today's talk. I'm pleased to welcome our presenter today, who is Astley Shields of the Fellows Workplace Solutions Group. And he is a specialist in office air treatment. Not surprisingly, perhaps he's going to be talking to us about air quality. And I think this is a topic which perhaps doesn't get the attention it deserves when we're looking at office environment in terms of normal health and safety issues. So I'm pleased we may be able to give it a higher profile today. As ever, before we start, I need to point out the opportunity, obviously, of putting questions to Astley. If you have any during the session, then please, in the box, dialog box on the right of your screen, you should be able to type in some questions. And then at the end of his presentation, I'll try to put a few of these, or as many of these as I can in the time we have available. I'll put those to Ashley, and he can hopefully answer those. If we don't get through all the questions, or there are any particular other issues that we need to go and search for, so to speak, then we'll put these online with the recording of the webinar as soon as we can next week. So all the questions will be answered, if not live now, then offline on the recording. So let me now hand over to Astley for his presentation entitled The Benefits of Cleaner Air in the Workplace. So Astley, over to you.
Thanks, John. Good afternoon, everyone, and thank you for joining today's webinar, Cleaner Air in the Workplace. Firstly, let's have a look at what we're going to be covering over the next 15 minutes or so. In a nutshell, we'll be taking a closer look at the air around us and the impact it is having on people in the workplace. That's people like you and me and everyone we work with. Now, it's possible that you may find yourself gasping at some of the facts I'll be sharing with you, but at the end of it all, I'm hoping you'll be breathing much easier just by knowing more about the subject and the things you can be doing to improve the quality of your indoor air. The main topics I'll be covering include air quality and pollution and what causes it, thinking small to reveal the biggest problems, the spreading of germs and viruses, how allergies and asthma are being aggravated, the impact this is all having in the workplace, where air quality sits on the health and well-being agenda, and finally, what can be done to improve things. I suppose a good place to start is to understand exactly what air is and the role it plays in our everyday lives. Put simply, air is the layers of gases made up mainly of oxygen and nitrogen that surround the earth, and as such, it's an essential element for life. We need it to breathe, but at the same time, it can be very harmful to us. Without it, we cannot survive, and there's a lot of it about. Whilst we drink around 2 litres of water each day, we actually breathe almost 11,000 litres of air every day. Despite the fact that tap water is perfectly safe to drink, companies spend millions of pounds a year on bottled or filtered water and next to nothing on cleaning the air that we breathe. Now, we hear plenty about pollution. We hear about pollution from factories and manufacturing plants as they chug out plumes of thick grey smoke and steely vapour. It's commonly linked to the fuelling of aeroplanes and sea and land-based vehicles. Pollution festers in decaying landfill sites, and there are thousands of other perpetrators contributing to the problem. These are just a few of the most notable man-made villains that are wreaking havoc in today's world on a daily basis. The World Health Organization recently revealed that a staggering 90% of people living in European cities breathe polluted air. And some of our major cities have now set up working groups to look at the effects of pollution and how we can combat it. There's no doubt that pollution is a major problem. We find it in our cities. It smothers our landscape and congests our transport networks. Yet in the vast majority of cases, we only hear about pollution in outdoor environments. So presumably we can find safety indoors, right? Wrong, I'm afraid. Outdoor contaminants from traffic and industry enter buildings by infiltration and through ventilation systems. Indoor air actually contains 5 times more contaminants than outdoor air. The Environmental Protection Agency ranks outdoor air pollution among the top 5 environmental risks to public health. And here's the real crunch. We spend on average approximately 90% of our time indoors every day. So if we're all spending this time indoors and the air is more polluted than outside, can you imagine the harm it is potentially doing? Now, sadly, I'm old enough to remember the days when offices were filled with so much tobacco smoke in the air, you could cut it with a knife. So yes, it's easy to understand why indoor air wasn't very healthy in the 20th century. But surely we've cleaned up our act since then. The problem is, however, there are lots of other contaminants causing a bad atmosphere in the home, workplace, and just about every other indoor facility. We're now going to take a look at something you cannot see. They're called particulates and include such things as pollen, minuscule bits of human hair and skin, bacteria, germs and viruses, smoke, dust particles, dust mites and mold, to name a few. They're measured in microns. 1 micron is 1/1000th of a millimetre, and particles measuring between 0.1 to 0.9 micron present the greatest health risk. They are small enough to get into the human lungs, but large enough to prevent them being easily exhaled. Now let's turn our attention to all the nasty stuff that floats about in the air. Public and shared spaces like offices, healthcare facilities and schools are breeding grounds for bacteria, viruses, dust and allergens, harsh chemicals and odours. Thorough cleaning and hand sanitisation are 2 ways to reduce the risk of cross-contamination and spreading the germs and bacteria. However, with millions of people getting ill each year, research studies show that airborne transfer is the main way of transferring germs and viruses such as the common cold and influenza. And as office density increases, there are more of us sharing the same air than ever before. So you can easily see how germs can rapidly spread. Germs can be airborne for a very long time, living for several hours and travelling considerable distances. The smaller the particles, the further they travel and the longer they remain airborne. Flu viruses are spread mainly by droplets that emit from flu sufferers when coughing, sneezing or talking. These droplets remain suspended in the air for long periods and blow over a great distance. They can then land in the mouths and noses of other people up to 2 meters away. A single cough or sneeze ejects small particles of the virus, which can then infect an entire room and remain airborne for hours. And it's a similar story for transmitting other viruses through the air. So how does all this impact on the workplace? Colds and flu affect 15 million people a year in the UK, and this has a significant impact on the number of working days lost. According to the Office of National Statistics, 137 million working days were lost to sickness in 2016, with minor illnesses accounting for 34 million of these days, and minor illness was given as a reason 33% of the time. It will also come as no surprise that sick days associated to flu account for nearly 8 million working days each year. And as this virus is commonly transferred through the air, you can begin to realise the importance of capturing it before it has time to spread. The most effective way to do this is to clean the air by purifying it. It is estimated that each absent employee is costing their employer an average of around £1,000 per year through a combination of direct costs, lost output and the provision of cover. I'll leave you to do the math based on the number of employees in your organisation, and you'll quickly see the real cost of absenteeism through relatively minor illness. Now let's take a brief look at allergens. There are a significant number of people suffering from allergies in the UK, with the most common being hay fever. Many more people are suffering from indoor allergens, including dust mites, mould, pet dander and fumes from cleaning products. These irritants also result in respiratory issues for those with asthma, which impacts 1 out of every 11 children and many adults. An allergy to these substances can cause anything from a runny nose or itchy eyes to an irritable palate or skin rash. Allergies can aggravate your sense of smell, sight and taste, and even the slightest touches can cause severe irritation. It is estimated that up to 40% of Europeans suffer from allergic rhinitis, with 43% of British people allergic to at least one airborne allergen, 36% allergic to more than one of them, and 11% say their suffering is actually worse at work. As with germs and viruses, the most effective way to reduce the symptoms is to remove the contaminants that trigger these reactions by purifying the air. Another factor that impacts on the workplace is odour. Staff and visitors to your premises quickly form an impression of your hygiene based on the smell. Is it fresh as a summer's morning, or does the stale air carry many odours? The presence of unpleasant odours, whiffs and nasty niffs can reflect very badly on your facility. Odours from people, food, office equipment, toilets, chemicals and stale air in general are the primary complaints made to facility managers and the key drivers for seeking solutions to eliminate them. Using aerosol solutions simply masks the problem and actually adds artificial contaminants to the air, which, if we refer back to earlier in the presentation, can actually trigger allergic reactions. I'd like to now look at the health and well-being agenda in general. The biggest asset to your organisation is its people. Health 2020 is a European health policy framework. It aims to support action across government and society to significantly improve the health and well-being of populations, reduce health inequalities, strengthen public health, and ensure people-centred health systems that are universal, equitable, sustainable, and of high quality. So as you will no doubt have noticed, the topic of health and well-being is increasing in importance on the political, economic and enterprise agendas. And organisations with the best health and well-being strategies are attracting the best employees, keeping them happy and retaining them. There are a number of initiatives that employers introduce to positively impact the health and well-being of their employees, such as tackling the sedentary office culture, promoting healthy eating and encouraging exercise. But in many cases, they don't relate the poor indoor air quality in their environment to the health and well-being of their people. In the majority of cases, the efforts being made to rid the workplace of germs and viruses and allergens are either low-key or actually non-existent. Quality of the air that surrounds these employees on a daily basis is being totally ignored. Clean air will improve the performance of mental tasks like concentration and recall and will help to reduce absenteeism due to illness. Clean air free from contaminants and harsh odours also shows care and concern for the well-being of your facility's occupants and customers, which in turn helps to cement loyalty. Research from the Building Engineering Services Association clearly indicates that improving indoor air quality should be a priority. The conclusions are stark, with 68% of respondents experiencing lapses in concentration and fatigue, and over half losing productivity as a direct result of poor indoor air quality. Commenting on the survey results, the Royal College of Physicians Special Advisor on Air Quality, Professor Stephen Holgate, said, "Indoor air pollution is often an area which is overlooked. The danger that air pollution poses to our health and well-being is considerable. A further report by the Royal College of Physicians linked 40,000 deaths to pollution in the UK alone. It's associated with a host of major health problems, including cancer, asthma, heart disease and diabetes. But while outdoor air pollution has long been in the spotlight, air pollution indoors is often overlooked, and it's a huge problem." So what can be done? Over the course of this webinar, I've talked about the problems that can arise through not addressing the impact of poor indoor air quality. Hopefully, you'll now start to appreciate how airborne allergens, odour, particulate matter and biological contaminants can have a serious impact on our health. It's clear that awareness of air quality is growing, and clean surfaces and touch-free environments are not enough. Unfortunately, air fresheners only mask odour, and they certainly don't do anything to destroy germs, viruses and allergens, the most harmful particulates that surround us in the air. The only real solution is to clean the air. High-efficient particulate air filters, HEPA to you and I, have been clinically proven to be effective at reducing the levels of airborne germs, allergens and particulates, and proven to remove over 99.9% of airborne contaminants such as germs, viruses, allergens and bacteria from indoor air. In addition, carbon filtration can remove the odours from air rather than simply masking it. So as we draw to a conclusion, I'd like to leave you with a few key takeaways. The air is alive with millions of tiny particles, pollutants and toxins. They're invisible to the human eye, but big enough to aggravate allergies and spread viruses. The vast majority of germs are airborne, which means air is the main channel for transferring colds and flu from one person to another. We spend 90% of our time indoors, and indoor air is 5 times more polluted than outdoor air. Waiting rooms, offices and receptions, and in fact, wherever groups of people congregate, are notorious for spreading germs and viruses. It's hugely important to protect your staff and reduce sick days, currently costing UK businesses £32 billion. Now, the Aeromax professional commercial air purifiers manufactured here at Fellows can capture the airborne germs, viruses, bacteria, and other harmful particulates. And a healthier environment means a healthier, more productive workforce, as well as presenting a good impression to visitors. That just about wraps up today's webinar. So thank you for joining me for the Cleaner Air in the Workplace webinar. Please get in touch if you want to know more about Aeromax professional commercial air purifiers.
Well, excellent, Astley. Thanks very much for that. I think, as you said in your introduction, there were some fascinating statistics that you were going to give us, and yes, I think many of them were quite frightening. And well, these are the environments that we all work in. I mean, one thing that occurred to me while you were talking was, if you put these filter systems in, where are they installed? At ground level, at floor level, and in the ceiling? Because
no,
you're talking about the way
they're retrofitted, John. The idea is that they're permanently fixed to the wall. They've got sensor technology, so they sense the pollution in the air and work accordingly. So the more pollution they sense, the harder they work in filtering the air.
Right. Yeah. No, I see that, and it's excellent. I was thinking probably most concerned because of the recent problems with flu in this, well, for all of us, I'm sure, in this country. You need to get those people who've got the infections, get them sitting next to the filter system to get rid of the viruses before they start floating around the office. But that's perhaps a bit too optimistic. So excellent. Thanks for that. I mean, is there any formal guidance? You mentioned the working parties, the Health 2020 and so forth. Is there any, though, looking at policy, if you like, but is there any actual formal guidance as to how we go about doing this that you would suggest?
Not really. There are European guidelines, and in some European countries, it's actually been embedded into legislation about indoor air quality. But in the UK, not really. There are building regulations, but that is really more about the levels of CO2 in the indoor environment. With regards to indoor air quality and the contaminants that I've been talking about, there is nothing embedded in the legislation. There is a little bit of European regulation, but they're more a guide than anything that people have to adhere to. Yes. So it's more about how important it is to employers to improve the well-being of their staff, really.
Well, very much so. I mean, I go back, or I'm drawn back to some of the old BSIs and so forth that were recommending so much. I've forgotten how many litres an hour one was meant to change the air in an office. Yeah. That, though, you're saying is really only directed at CO2 levels and so forth.
Yeah, absolutely. And when you're exchanging the indoor and outdoor air, is that you've got with pollution being so bad, particularly in major cities, is that actually, although you're reducing the levels of CO2, you are actually bringing contamination into the building in the form of the outdoor pollution that you're bringing back into the building.
Diesel particulates and so forth as well.
Particulate, pollen, which is aggravating people's hay fever. So all of these things are actually being brought back into the building and quite often circulated throughout the building by the air handling systems.
Okay. Well, we've got a few questions here that I will try, and forgive me for my stilted reading of them. One here says, we have an air handling unit with a filter. Is this similar to what you are promoting, or should this be running alongside an air purification system?
It should absolutely be running alongside an air purification system. What you find is the air handling units, not the filters that they normally have in them, are basically dust filters. and they protect the really large particles of dust from coming into the building, but they don't filter the. You'll hear the government talk a lot about PM 2.5 as being the particulate size and the standard, and the normal filtration systems on air handling units don't do anything with PM 2.5.
Right.
And bringing that in, and what it also won't do anything with is actually filtering the contamination that you or I produce while we're actually in the building. So the germs and viruses that you and I are producing.
Right. Yes. Some salutary information. Okay. Another one. How long do the HEPA filters last before they need to be changed? And indeed, well, and somebody else is asking a similar question about the cost of these filters and systems.
The filters, it's normally an annual change. So you would normally build it into your normal maintenance program. So there are a couple of different sizes of unit. The smaller unit takes one filter set, the larger units take two, and it's all about the volume of air that you need to move and the size of the room. But it's normally an annual change. With regards to cost, it would purely depend on the size of facility and the number of units that you would need in a particular environment.
Right. Yeah. And I'm sort of reluctant to get too far down into that one, but perhaps the individuals interested in this can contact you directly if they need.
No, absolutely. They can contact me direct or through Posturai, and we can have a conversation. It would probably involve me coming out and doing a survey of the site and confirming how many units would be needed. But yeah, that can be. We can cover that offline. Absolutely.
Okay, thank you for that. And Kim Jackson, along with asking about the air handling unit, they say that we also have fan coil units that deliver our heating and cooling, and each of these have filters that are changed on service schedules. But does this type of system assist with the reduction of any pollutants in the office air?
Not really. Obviously, they're just heating and cooling the air, and the filters on those systems are normally there to protect the working parts of the system from larger dust particles. So those filters are working really to protect the systems that are in place, as opposed to cleaning the air that we're breathing, really.
Right. Yes. Yeah. Okay. No, that's excellent. And whilst there are still some things coming through, someone is asking if they can have copies of the presentation that they can, so they can use the webinar towards. That's for the CPD. Yes, and we normally, what we do with that is if people let us know, then we can send a certificate for CPD attendance, so forth at these sorts of webinars. So let us get in touch with Postrite, and that will be done, I'm sure. But okay, Astley, thank you very much for that. Very informative. For me, quite frightening about what risks we're exposed to. But hopefully with spring now here, we're going to have less of the viruses and bacteria problems. But again, as I say, thanks very much for answering the questions. And if any come in while we're talking or in the near future, we'll put these on the website along with a recording of the webinar, and that will be available along with the answers early next week, I believe, on the usual Postrite webinar page. So once again, Astley, thanks again for your time and for the presentation. And also, can I thank everybody who's been listening for taking the time to join us, and have a great afternoon. So thanks, everyone.